Hi, everybody. My name is Ashley Hodson, and this is my population level health education intervention presentation for Nursing 447 Communication Health Nursing for California State University of San Marcos. So to introduce the 4 health-related issues of my population is Long Beach, California. The first health-related intervention is homelessness, which has been one of the leading problems in Long Beach, and that was according to the Press-Telegram, that 64% of Long Beach homeless population lived in places within the boundary lines of that closest to downtown Long Beach and then also to North Long Beach, which is my lower income neighborhood that was used for comparison. The second health-related issue is diabetes. So according to the Long Beach Health Department, that was provided as a 2010 statistics, diabetes was the 7th leading cause of death in Long Beach, which showed that there was initial need for adjustment of teaching for this population. The third health-related teaching was obesity, in which the United States, 1/3 of all American adults and 17% of children are considered obese. And in the Long Beach Unified School District, there was a measurement that was taken for 5th graders where 31.9% of them were considered overweight. And this statistic was taken back in 2013. And the fourth related health issue is the mental health disorder or mental health illness. So mental health affects social and behavioral aspects across all lifespans, and according to the Long Beach Public Health Department, it indicates that community mental health are related to hospitalizations, which includes diagnosis for schizophrenia, affective psychosis, neurotic disorder, and paranoia or senile state. So background and significance in Long Beach. So homelessness was most prevalent in downtown Long Beach, and then in downtown Long Beach there has been a lot of reconstructions, which also shows that a lot of the homeless populations were being pushed to the outer rim of the city, and most of them were being located at very major bus stops and then under freeway overpasses and near the San Gabriel riverbed. And some of the leading causes were just because of the lack of clinics that were offered for mental health issues. Diabetes, and this was according to a major stakeholder who was a nurse at St. Mary's Hospital in downtown Long Beach, and that there was an increase in admissions for people who were diagnosed with diabetes. And a lot of the ICU patients that were in the hospital were people who already had end-stage complications due to diabetes. Obesity was another significant drop for this city, and that was provided by the major stakeholder where I did my population intervention for teachings. And she had stated that a lot of the children that were in the after-school program were actually either overweight or obese, and this was just due to knowledge deficit. And lastly, mental illness. So according to the same major stakeholder who is the nurse, a lot of patients were being admitted through ER coming in for problems of mental illness, but were receiving health diagnosis, not properly addressing mental health issues, but were given medical treatment. So Healthy People 2020 objectives. For homelessness, according to Healthy People 2020, objectives are homeless is to improve access to comprehensive quality healthcare services. And this is important for promoting, improving, maintaining health problems and for diseases and reducing disabilities. Mental illness, objectives were, according to Healthy 2020 again, objectives were to improve mental health through prevention by ensuring access to quality health care that was addressed towards mental health services. Diabetes, it's to reduce the disease burden of diabetes and to improve the quality of life for all persons who have or are at risk for DM. Lastly, for obesity, it's to promote and to reduce chronic disease through the consumption of healthful diet and achievement and maintaining of healthy body weights. So needs for assessment of Long Beach. So this was also evident through the windshield survey project and also communicating with community and population stakeholders. So for homelessness, my one major stakeholder is Leticia, who is the director of the YMCA where I did my teachings at. And she told me that homelessness is a big issue in Long Beach. Many of the veterans are left without opportunities to job, and some even young teenagers or adults that get caught up in drug abuse. and some teenagers witness drug abuse at home and fall into the same patterns. So because of the lack of quality healthcare, homelessness is a big problem. And also you see a lot of homeless when you're driving around the city in North Long Beach or towards downtown. Mental illness, the need for assessment. So according to Stephanie, who is the nurse at St. Mary's Hospital, she says that mental illness is a big problem in our area, and Long Beach is still doing its best to address the issues by building more mental health clinics, but the solutions that the city can provide is moving at a slower rate than how fast mentally ill end up on the streets or fill up our ER. Now for obesity, Leticia, the director for YMCA, she says that many of the kids that end up in our after-school program are already overweight, and this is due to lack of finance for proper food that is better for health and just no prior teachings from their parents. Many of the kids in the nearby neighborhoods are the first generation to attend school or higher education from parents that may have immigrated from Mexico or other foreign countries. So due to lack of education, there's not been proper teachings handed down from the parents to the kids. Lastly, for diabetes, from major stakeholders, many of the statements were that many of the families in the close-by neighborhoods are either African American or Hispanic, and some of them have cultural taboos on how they address their health issues. Either they go directly into their culture to get treatment, or they just don't believe in American treatments in the hospital. Now, my theoretical framework proceed model. Through phase one, using the windshield survey and speaking to the community members, the 4 problems that need to be addressed was proper nutrition, proper education of chronic diseases such as diabetes, hypertension, obesity, mental illness, and homelessness. Predisposing factors were hugely cultural barriers, lack of quality education, language barriers, and knowledge deficit of community resources to the surrounding area. Now, phase 5 through 9, education, assessment, implementation, and outcome evaluation. Education and assessment, the big major thing was cultural barriers, breaking myths of health, literacy with an average reading level of about 5th grade, language barriers where most of my audience was only Spanish speaking, and knowledge deficit of proper health maintenance of one's own health. Implementation. So the goal was to build an education plan that teaches about community resources of health promotion, addressing prominent chronic illnesses of diabetes and all the other illnesses I previously mentioned, and building of knowledge of homeless shelters, mental health clinics within distance, and teaching of self-therapy addressing mental illness. Now, the hopeful outcome was a class teaching session, leaving community members knowledgeable of what they can do to help change their health. What resources in their surrounding neighborhood can they use to help better their health, and also impact the importance of addressing mental illness that also impacts motivational factors for health maintenance. So some of the issues that I came across for the community was basically cultural barriers. So my audience is basically Spanish speaking and I'm English speaking only. Also, cultural taboos of health and maintenance. So to the Hispanic culture, sometimes reaching out for help is against their culture. So even if you have a mental illness or if you're addressing your own physical mental health, usually they go to somebody within their cultural subset to be able to get treatment before they actually go to the hospital. Educational barriers, so low literacy level of 5th grade reading. So I had to make sure that all of my reading and my teaching materials were at an elementary level reading so the information could properly be communicated and processed. And then also prior knowledge of chronic diseases. Not a lot of my audience was really aware of what hypertension, what diabetes, and what obesity really meant to their health. And then knowledge deficit, also knowing what their community resources were and how they were able to utilize them. Now, communication population interventions. For diabetes objectives, there were 3 objectives: reduce the annual number of new cases of diagnosed diabetes, improve glycemic or blood sugar control amongst the individuals who were diagnosed with diabetes, and improve lipid control among persons with diagnosis of diabetes. So for those interventions, for the teachings, I addressed teachings of insulin management. So I taught them what insulin was, how it was administered, and how it was supposed to be properly stored. And that also helped to address the objective of improving glycemic control within the population of people who were diagnosed with this disease. Teaching of proper nutrition with diabetes. teaching them how to carb count, meal prepping, proper food portions, and limiting alcohol intake due to the high fact that alcohol is a lot of sugar. So this addresses objectives of lipid control with persons diagnosed with diabetes. And then now visual demonstration of diabetes disease process and complications with return verbal understanding. This addresses the reducing of annual numbers of new cases. So if people, as a primary intervention, so if people are aware what diabetes is, hopefully it prevents people from being diagnosed and later on having to deal with the complications. Now for obesity, the 3 main objectives from Healthy People 2020 was to increase the proportion of adults who are at a healthy weight. Also to reduce the proportion of adults who are obese, and then to reduce the proportion of children and adolescents who are considered obese. So the 3 interventions to address those objectives was to teach of the 5 meal plate, incorporating the proper portions of carbohydrates, proteins, and lipids for a balanced meal, teaching of proper exercise regimens, completing 30 minutes of cardio at least 3 times a week, and plyometric training to help reduce weight. And then also teaching of eliminating high sodium or saturated fat foods from their normal diet to teenagers and children, such as chips, soda, and fast foods. So this also addresses the issue of the proportion of children and adolescents who are considered obese. Now for budget and logistics. My location for YMCA, I only had to talk to 2 directors, in which they gave me free access to the meeting room that I was provided for teaching. I just had to make sure that I notified them ahead of time to be able to reserve the spacing. I also did this teaching or the community classes on volunteer hours, so there was no compensation for pay. And also there was no additional training that was needed to be able to provide the instructions for classes. Now for the cost of the location, it did not cost anything. The presentations that I did for nutritional therapy and for diabetes was on my own computer, but the lack of resources for providing a projector, I ended up having to buy my own projector to be able to present the information, and that came out to about $100. And then also teaching handouts, in which I made multiple copies of for both classes, and that came out to $739. So a total of $107.39 for the teaching of both classes. Now, project evaluation. The goal is to increase knowledge of chronic illness of diabetes and obesity and awareness of community resources for health promotion and maintenance, and provide educational resources to reinforce teachings. So before the class, I provided a pre-questionnaire, and then after class, I provided a post-questionnaire and was able to compare results to give my proper evaluation of my teaching. So the diabetes objectives was, I was hoping 75% of the class would be able to successfully demonstrate back to how to prepare, purchase, store, and mix insulins by end of class. 100% of the class will be able to verbalize the difference between type 1 and type 2 diabetes. 80% of the class will be able to describe 2 disease complications of diabetes by end of class, and 100% of the class will be able to identify 1 risk factor that leads to diabetes. Now for nutritional therapy, the objectives was the class will be able to verbalize 1 type of food from the Healthy 5 plate. 60% of the class will be able to verbalize how much sodium intake is required by end of class. 100% of the class will be able to identify 1 high saturated food normally consumed that could be eliminated from their diet. And then 100% of the class will take a teaching packet by end of class. So the main points, as I said, was just to teach the importance of diabetes, also the disease process, insulin administration, and the impact of the complications. For the nutrition teaching, it was to teach about the 5 plate, how to set up your own exercise regimen, the amount of exercise required to maintain your weight, and 80% of the class was able to give a verbal understanding. So the weaknesses in my teaching was that most of my audience was Spanish speaking. So that was a big barrier that I had to keep overcoming in my class. And I was able to address that by having 2 translators, which luckily enough, both YMCA directors were both bilingual. And also the problems encountered was the shortage of handouts in my nutritional therapy class. So luckily enough, one of the directors were able to make more additional copies for me to be able to give to the rest of the class. And that concludes my presentation, and I hope I get to see everybody else's. Thank you for watching.